The idea of single-payer healthcare has been gaining traction among House and Senate Democrats in recent weeks. Is this idea attractive to you or not?
That's a terrible idea to me. I think we've seen what government involvement in healthcare does. I want to go in the opposite direction, but the Democrats are fairly well unified in this, and I think if we give them another chance, if they get control of the legislature, Senate, House, and Senate, they will go for single-payer. They won't stop.
So how does the Republican Party win the narrative? The Democrats won this narrative right from the beginning by convincing people, tens of millions of people are going to be thrown out on the street. It's just a matter of how many are going to be suffering.
Right.
How do we reverse that?
Well, I'd like to say that we'll get better at this. They're excellent at it. They're totally united. And when I go home, you literally run into people who think that there are going to be millions of people dying on the streets. So we're the most generous nation in the world. We always take care of people. The question is, how do we pay for it?
But that's the message Democrats have been selling. So arguably Republicans have been weak on their messaging and their selling of their views on this.
Well, I have a few message points that may be helpful. This bill has some attributes that are positive for Alabama. In the non-expansion states, there's a $2 billion safety net funding, and there's going to bypass $2 billion of dish cuts that start in 2018 that ramp up to $8 billion in 2024. So being a state that didn't expand Medicaid, that's not overburdened with that increase in cost and now budgetary issues, there is a silver lining.
There is, and I'm glad you say that, and my number one priority is making sure Alabama is not mistreated. I think in terms of the narrative and how we sell this, what I hear more than anything else is, Congress, do something. You promised to do something. Fix this, and fix it in a way that's not just conservative, but it actually involves some common sense. And that's the narrative I'd like to see us pursue.
What are your suggestions on if you can't come up with a consensus and if you can't get something passed, just trying to repeal and then come up with something to replace?
Well, I think common sense would tell you, and to keep our word and to give confidence to the people, we should repeal it. Allow some time period to try and see if the Democrats will come in and negotiate with us and get it done over a period of a couple of years. I'm told that's not possible. I'm not sure why. How you support insurance markets, the fallback that I'm hearing now, I'm not sure how that would work.
All right,
how much real flexibility can you give governors? A lot of states want to do real reform on Medicaid. Indiana wants to do health savings accounts and the like. Kentucky's doing it. Alabama, you mentioned. So if you can pay now but get flexibility, that's going to save a bundle in the future.
Absolutely. I mean, we need to put more power back to the states, the health care decisions closer to the people. I'm all for that.
All right.